Dear students, welcome back. Here we can see the secondary muscles which control the temporomandibular joint motions. The secondary muscles are smaller than the primary muscles and consists of suprahyoid and infrahyoid groups. Here this is the anterior aspect. So this one is the hyoid bone and this one is the mandible actually. And behind that you will have the cranium, posterior aspect of the cranium here now, and below you'll have the clavicles, and here you'll have the sternum, and the posterior aspect scapula. Okay, so the muscles which are present, which are connecting the hyoid bone to the cranium and the mandible, are called as suprahyoid muscles, and the muscles which attach below the hyoid to the sternum and the scapula or the infrahyoid muscle groups. Okay, so now the muscles present in the suprahyoid group are: one is the digastric muscles and geniohyoid. Here we can't see the geniohyoid, and here this one is the mylohyoid muscle, and next one is the stylohyoid muscles. So the digastric, also the anterior belly we can see here, and the inferior aspect below the hyoid bone, one is the omohyoid bone, this one is the omohyoid bone, and next one is the sternohyoid muscle. So this hyoid muscle is connecting with the sternum, and then the thyrohyoid, which is attached to the cartilage, thyroid cartilage, and another one is the sternothyroid muscle. One is the omohyoid, sternohyoid, sternothyroid, and sternohyoid muscles. Okay, these are the sternothyroid and thyrohyoid muscles. Okay, these are the total 8 secondary muscles which helps in the temporomandibular joint motion. Mainly the suprahyoid muscles mainly assist with mandibular depression, while the infrahyoid muscles are responsible for stabilizing the hyoid bone during mandibular depressions. So both suprahyoid and the infrahyoid muscle groups are involved in speech, tongue movements and swallowing. Okay, and the posterior fibers of the digastric muscle, which are attached to the mastoid notch, and while the anterior fibers attached to the inferior mandible, helps in the mandibular depression. During this depression, the hyoid bone is stabilized by the infrahyoid muscles. Okay, this is about the secondary muscles which helps in temporomandibular joint motions. Thank you.